Hey guys, welcome to another episode of Ask Dr. J, and today we're going to talk about the benefits of digital dentistry combined with an in-house dental laboratory. So when you're at a practice that has these types of technologies, and in our office we have 3D facial scanning, 3D tooth scanning, 3D bone scanning, 3D printing, milling. So these are the things that come together with actually CAD/CAM design, and with this whole workflow, we can really make patients' lives easier in the dental office, make it faster, and actually helps us to cut costs as well. So let's talk about some of these things. First, when we have the ability to scan your teeth, when you come back in a year, by the way, we can scan them again and see as like a wellness check, have your teeth changed. So if you're someone that thinks you're clenching or grinding, but you're not certain, we can do a very quick three-dimensional scan of your teeth before when you first come into us, and maybe a year later or 18 months later, and actually measure in microns or portions of millimeters how much tooth structure has been worn away. And that's important because you should only lose 1 millimeter of tooth structure in 100 years. Otherwise, something is wrong. So that's just one little way. But let's talk about the actual workflow from a digital dentistry and laboratory standpoint. So you come in, this is an example, and you've broken a tooth off, and we're going to place an implant. And we need to now find a way to put a tooth in. And let's say it's a front tooth, right? That's the one that you don't want to walk around with nothing. Now, of course, it does vary from patient to patient depending on your bite and other factors. But using the digital dentistry and in-house lab workflow, we can go ahead and scan your mouth. And then using a software called exocad, and there's some other ones, we can actually take that and duplicate the other tooth if we like that, or make changes in this software and tweak it. And you can actually look at it if you'd like, or maybe you do that further for the final. But the point is that when the implant goes in, we scan it, print it out, and then we can just go ahead and screw the tooth in. Again, this scenario is describing a front tooth, not a back chewing tooth. That's a little bit different. And I don't want to go into the biology behind implants in this video. I have other videos that talk about that. But you can see how that'd be a benefit. And here's another thing. So let's say that we have made you a temporary on an implant or another tooth and it breaks. Well, we have that file. And when we get that phone call, hey doc, or if you're talking to the patient care coordinator, hey, we just want to let you know I broke this tooth. I'm leaving on a plane tomorrow to go to Europe on a work trip. You know, what can I do? Well, as soon as we get that phone call, we're scheduling you, we're going in the back and we're printing it out. So when you're here, there's no having to remake it in the tooth, which is the way I used to do it all by hand. Love doing it, it's artistic, but with the technology, don't love it so much anymore because now I can plan it, print it, you come in, put it in, and there's no smelly acrylic going on. It smells like you're a nail salon in your mouth, and you get that tooth faster, more predictably. We use that same technology, by the way, when we do our All on X or in our office one-shot smile, and that's when you get a full row of teeth supported by 4 to 8 implants. So for instance, we are going to go ahead and plan your smile before you ever come in. We take our set of records, we plan it, and then day of surgery, we scan the implants. It goes to the CAD/CAM designer. Right now, we are having someone else design for us. They send us the file back in 1 hour. We print your teeth out, stain them up nicely, make them look pretty, and go ahead and screw them into the mouth. And again, the great thing is, let's say you're moving to a zirconia or the really nice high-end finished full arch. Well, we have to wait at least 4 months for your teeth to heal. And if your temporary breaks, or maybe you have to go a little bit longer to spread out the cost, well, guess what? We just go ahead and print it out and put another one in. In fact, I don't even have to be here and do that for you. My clinical partner or assistant can do that. They are certified to do that. So what's the alternative if you have a full arch implant temporary and it breaks and you don't have an in-house lab? Well, first off, when you make that phone call, I don't even know what's happening. I don't know if we have the parts, if I'm gonna have to put like a metal beam inside the temporary to kind of patch it up and then have to order a new one from the lab. So it's gonna slow the process down. There's uncertainty, which basically creates stress for you as the patient and even for me as the doctor, because I don't want you walking around with broken or no teeth. And again, it's more time for you, and also it also can be more money, because as we bring this in-house and do this in-house, we can bring the cost down to help that be a more reasonable procedure. So another example of how an in-house lab can be helpful is if you have a single tooth in the front that's being replaced with a crown or a veneer. One of the hardest things in dentistry to get symmetry or a harmony, I'll say, with a dentist and a lab technician is matching one tooth or one crown to one natural tooth. And I've seen that tooth go back 3 or 4 times to get the shade correct. Some dentists will even say you have to do to the front tooth to match it. But if your other front tooth is perfect, why do that? So with an in-house lab, we can actually start off with a basic shade, and the technician can walk up to you and match it right there in the mouth, look at it, and then go back and put it in the furnace or basically the oven to solidify that color, harden the ceramic, and bam, it goes right in the mouth. So lots of benefits of this in-house lab combined with digital dentistry, including it's going to reduce your cost, it's going to reduce your time, it's going to give you better results, and it's just going to be a less stressful experience all around. So another benefit of having an in-house lab is if you have a single tooth in the front that you're trying to match to a natural tooth. So you've got a perfectly healthy tooth, you broke one tooth off and you need a crown or an implant. And this is one of the hardest things for dentists and lab technicians to get right. And myself, I've had a patient that we were matching one tooth and it went back to the lab 4 times to get the shade correct. This was a patient that did not have your Hollywood white teeth that were all one shade, natural, beautiful looking tooth. And every time it came back, it was closer, but it wasn't right. Why? Because the light is different at the lab. When you're trying to give images, the camera's got to be perfect, and it's just a very difficult thing to do. Some dentists will even say, if you have a single tooth that's broken, you need to do the one next to it just to match it. And sometimes that can be good if you need it, but if you don't need it, why do more work than necessary? So with the in-house laboratory, we can bring the implant crown or the crown into the actual operatory. Look at it with you, the patient. The dentist is looking at it. The lab tech's looking at it. And we're doing the staining of the ceramic right there so that you can see what it's going to look like before we take it back for finishing and final processing manufacturing. So it's one of the things I love about the in-house laboratory is shade matching. So just to kind of sum it up, what are the benefits of having this digital workflow with an in-house laboratory? Number one, it's definitely going to save you time. Less appointments. For full arch dentistry, we can get you done in as little as 3 appointments. 3 to 4 is the average. The second piece is it's going to save you money. Laboratories charge more and more for these. You'd be surprised at how much they charge for full arch cases, crowns, implants. And so when we can bring this in and fabricate them, yes, it costs us money to produce it, but we can pass the savings along to you, whatever they may be. And any savings is better than no savings. So we really take pride in that. The third part is it's going to provide a more predictable result and a better result. As we talked about with shade matching, as we talked about, you can be part of your own smile design. The software, even if the designer is off-site, we can bring the actual software in for you to look at. And you may say, I like the shape of the teeth. We try them in, and maybe once they're in your mouth, we want to change them up a little bit. Well, guess what? We don't have to send out for a lab to get another temporary or another full set of teeth for you to look at. We do it right here, give it to you, and then you walk away, walk around, try them. And in fact, we don't even, for these full arch cases now with implants replacing a full row of teeth, we don't even do try-ins anymore. We do prototypes. And the difference is that it's hard for you to try something in and say, okay, it looks great, I like it, it feels great. When we give you a prototype, you get to walk around, take it home, have your spouse look at it, have your family look at it, have your friends look at it, chew on it. We tell people, go home and have at it. Eat what you want, do what you want, smile, get feedback. It's the only real way to know if this is going to be what's right for you. And then when you come back, we can either change it, tweak it, or if it's right, we can go ahead and then scan it. And in the back, in the in-house lab, mill the final ceramic zirconia restoration, stain it beautifully, and put it in your mouth. So again, lots of benefits to this process, the digital design, the in-house laboratory. So I get very passionate about this. If you found this helpful, do me a favor, go ahead and like the video or subscribe to our channel. It really helps. And also share this information with someone else. Thank you again for watching another episode of Ask Dr. J.